So, hello, everyone. Good evening. We are going to go ahead and start shortly. We're talking with Dr. Diamond today, who's a chiropractor, and bringing her on to tell her story and to educate you guys on how to get into chiropractic school for those that are interested. So give it probably 20, 30 more seconds. Share it, please. Let everyone know that we're on so that we can get started. All right. So we will go ahead and get started. So it's Dr. Mister of Sow and Reap Physical Therapy. We are back with part 2 of our virtual Black History event. And again, it's geared toward the youth and young adults to educate them on different careers. And please, if you have any questions or comments, please put those up. And if you don't want your information on the screen, also put that in there too. And I won't bring you up because some people are kind of shy, and I get that. But go ahead and if you have any questions, please put those up because she's here. She's been through it. She's been through the schooling, and she knows all about it. So a little background about Dr. Brown. So Dr. Diamond Brown is a former military brat graduating from Louisiana State University in Shreveport with a bachelor's degree in cellular and molecular biology in 2009. She moved to Dallas, Texas with a desire to become a chiropractor shortly after graduation, where she attended Parker University. She obtained a doctorate of chiropractic in 2013, as well as a bachelor's degree in anatomy and health and wellness. She currently works in her own practice, Diamond Chiropractic Health Center, since 2014. Dr. Diamond has a passion for education, especially those in the Shreveport and Bossier City community, on chiropractic care for all ages. She believes that the body was divinely made and has a strong respect for its healing properties. She aspires to assist in restoring the body to its proper functioning and divinely made condition. During her free time, you can find Dr. Diamond going on adventures with her toddler, who is so cute, by the way, and her husband, and renovating her 1950s ranch. So let's go ahead and bring up Dr. Diamond. Hey, hey.
Oh,
how are you?
I love it. The water's high enough to get the paint off.
You're good. Like everybody's just at the house anyway, right? We can't go anywhere because we're all snowed in and iced in, actually. So, yeah. So, thank you again for coming on and sharing your story and to educate the youth on how to become a chiropractor. Because I get asked that quite a bit. I've had like 2 or 3 people contact me, and I'm like, well, I'm a physical therapist. I know there's some overlap between PTs and chiropractors, but we're going to let you tell about the chiropractic part. All right. So tell us about yourself. Where are you from? What high school and college you attended?
I went to Leesville High School. I am a Wampus cat. Woohoo. Ended up there from the military. My dad was in the Army. And then I left there, came to Centenary College of Louisiana. It's a private school in Shreveport. Spent 3 years there, transferred my last year to Louisiana State University of Shreveport and graduated from there.
All right. Are you a member of any special organizations that you want to recognize?
I'm a member of the International Chiropractic Pediatric Association, as well as the American Pregnancy Association and BirthFit. So you can kind of see what my specialty is.
Yes, women's and pediatrics. So, and it also said you would like have your Webster technique certification. So do you want to explain that, what that is?
The Webster's technique is a specific technique that I use, or that chiropractors use in general, for pregnant women to optimize the amount of space in the pelvis to allow for an easier and better, faster labor. Gotcha. All right. So chiropractors, what exactly do you all do? Well, there's a lot of things we can do, but what I actually do is I adjust the spine and other joints. If there's a joint, I tell this to people all the time. If there's a joint, I can move it.
Okay.
But we align mostly the spine to remove subluxations, and subluxations are misalignments in the spine that cause nerve interference.
Okay, gotcha. So you guys, if you're having any pain, she can help with that. And it's important to have, a strengthening program and adjustment through the chiropractor or PT, and then have like a massage therapist in your life, because to keep those muscles relaxed, because that's something, it's like a maintenance program as we get older. We need those things to keep our body in alignment and healthy,
Absolutely.
So go ahead.
I said, absolutely.
Yes. So how did you find out about your career? Was it something that you always aspired to be, or was it something like along the way you found it?
Girl. I am half Asian, so that means my mother harped on me being a doctor my entire life.
Okay.
And so I had plans to go to medical school, and after graduation, I had like a semester off. I was trying to kind of figuring out life and what I was going to do. I was studying for the MCAT, and my friend was like, "Hey, you should check out chiropractic." And I was like, I don't want to deal with any back pain.
Right.
And I was like, you know what? I actually do need a job. So I saw that there was an opening at a chiropractor here in town. He needed a front office receptionist.
Okay.
So I went ahead and interviewed there, and I worked there for a little bit. And let me tell you, I saw the most miraculous things happen in that office. And I learned that chiropractic wasn't just about neck pain and back pain. It's about a whole body healthy living,
Right.
Things that you learn from your chiropractor, you don't learn from your medical doctor. You spend more time with your chiropractor than you actually do with your medical doctor.
Right.
It's pain. The most interesting story that came about that made me want to be a chiropractor is there was this lady who had like 3 little boys, and those little boys were awful. I hated when they came in. She was in tons of pain. She was on lots of painkillers. And she slowly got off of every single med.
Wow.
And their behavior changed. And then at that moment, I saw not only did this affect her, but it affected her entire family. And this chiropractor changed this entire family's view on life. They got everything. These kids were totally different. And that's the moment when I was like, I want to do that. I want to make that change in someone's life.
Gotcha. Wow. Well, the mothers, the backbone. I said the backbone, not to say the fathers aren't important, but when it comes to the kids, we are there. We are there, So yeah, I can see how her feeling better. She was better able to attend to her kids. So that's awesome. Yeah. So okay. So what about mentors? Did you have any mentors or coaches that helped you along the way besides the chiropractor that you spoke of?
Yeah, the chiropractor that I spoke of, he was my mentor the whole way through. When I came back, he guided me into opening my own practice. So I
Yeah. Good deal. And you've been open since 2014. So
2014, girl.
Yeah, yes. You guys, Dr. Diamond, let me tell you, she is my inspiration. She has a lot going on with herself, and it's just seeing you power through everything is amazing, and you are my motivation. I remember the first time I met you. We talked on the phone once, and then I came by. And I was telling her about what my goal was and how I wanted to open up, a practice in pelvic floor physical therapy. And she says, okay, so what are you doing? And I'm like, what do you mean? She said, you just sitting at home? I was like, I guess so, until I figured this out. She's like, come on out. Come on. You got it. Go get to work. She was like, we need you. And I'm like, thank you for that. Because I needed to hear that. It's like, it motivated me to keep going and keep pushing in. And a lot of people look at physical therapists and chiropractors as competitors. But I must honestly say that you and Dr. Cruz have been a blessing to me. He actually gave me a softer opening. He allowed me to, open up my clinic there and build my knowledge of business. And then you, with your guidance and your inspiration and just seeing you push through, it's just, thank you. Like I knew I had to have you on for this Black History event, because you are absolutely amazing, you guys. If you're in Shreveport, Bossier City, Dr. Diamond, she's amazing woman. Just to get to know, like you just, she will tell you like it is. Now, are you ready for that? She's not going to sugarcoat it, and I like that. I don't know about everybody else, but I love that about you. So, all right. So, is there any special type of training or schooling? Like, do you need a bachelor's degree to get into chiropractic school? Like, what do you have to do before you can apply to chiropractic school?
You definitely want to have a bachelor's degree before you go in and have like some sciences down. But a lot of chiropractic programs have a bachelor's program built into it. So you can get your bachelor's degree through the chiropractic program and then transfer over into the chiropractic program. But it's mainly
Gotcha.
sciences. It's the same stuff that you would do when you're getting into med school or something like that. So you can have a degree in anything, but you just got to get your sciences down and then you can accept it into the program.
Gotcha. Get your GPA up, keep that up, and
Yes.
that's the biggest thing. They really just look on at the prerequisites, and
Right.
make sure you keep high scores in that. So,
You're just a human being.
right. So, what did you like major in when you were in college?
Cellular and molecular biology, because I'm a big nerd. And let me tell
Okay.
you, if you're going to get a degree in anything, go ahead and get your degree in business.
Okay.
And,
True.
and then prereqs. Because what am I going to do with a biology degree if I didn't get into chiropractic school or med school or anything like that?
True.
Nothing.
I get you. That's
You
true.
can do nothing with a biology degree. I
Right.
love science, and I probably would have went into a lab or something like that. But for the most part, people just go, I need a biology degree so I can get into med school, and that makes zero sense. Get a business degree or something like that, something useful, and then get your prereq.
Yep. Just see straight. You just tell it like it is, and it's true. It is so true. Yeah. I totally agree with you. That's why I changed from biological sciences. I'm like, what am I? If I don't get into PT school, what do I do with this? Like, so yeah. Besides teach, you can always teach. You
can always teach, but like, these kids.
Right. Right. All right. So, personality. You mentioned that. What? Or you think there's any type of special skills or personality type that a person needs to be a chiropractor?
I think you'd be any personality type. There's always going to be a patient out there for you. There's always going to be a practice out there for you. Even if you don't want to own your own business, like you can be an associate in a great chiropractic office and thrive.
Gotcha.
Honestly, business isn't for everyone, so I completely get that. And you just want to work for somebody else. And it's a great business to be in, especially when you are changing the lives of different people.
Gotcha. So as far as like, because you, again, pediatrics and women's health, that's your major focus in chiropractic. Is there a reason? Like, why did you decide to go that route?
Okay. I have a Jesus complex.
Okay.
I want people to listen to me and to do what I say, which is kind of awful. I'm an Enneagram, if anybody knows what that is. Like, I can't help it. It's my personality. But I originally went to chiropractic school because, girl, I had plans to marry Dirk Nowitzki, so I was like in his neighborhood all the time. I was going to be a sports chiropractor. I was going to be the chiropractor for the Mavs, my basketball team. Marry Dirk Nowitzki, and my life was going to be grand. And then I started treating athletes, and athletes are the most non-compliant people on the planet because they just want to get back in the game. What's my quick fix so I can get back in the game? So they're very non-compliant, and you don't really truly heal anything, Yeah. So I decided who would listen to me and, do whatever I said. A mom, because she loves her child and she'll do whatever she needs for her child.
That's right.
I started off there. The first time I got to feel a baby kicking someone, fell in love.
Oh, gotcha. Wow. It is amazing though. The whole process of being pregnant and delivering also.
Yeah, it's really miraculous.
Yeah, it is. It really is. All right. So what are the pros or the benefits of being in your career? Like, what do you love the most in saying, hey, if you want to be a chiropractor, this is great. This is why. This is great.
I love the most that I can see how self-healing the body truly is. Like, I am just a vessel. I adjust someone, remove the interference from the nervous system, and I relieve dis-ease, which, you've got like the disease and dis-ease. I'm not talking about diseases. I'm just talking about dis-ease. I relieve that. And the body just does its thing and it heals. And everybody always comes in and says, oh, you did this for me. You did this for me. No, girl, you did it for yourself. I was a vessel that helped you get there.
Right.
And to be a part of that journey for someone, to be a part of someone's healthcare journey is truly amazing.
Gotcha. All right. So on the other side of that, what are some of the things that you're like, hey, if you're going to be a chiropractor, watch out for these. These are the things that really, it makes it less fun.
Medical doctors are not going to be your friend for the most part.
Oh, no.
You think you're crazy? You think you're going to snap someone's neck? They think that you can cure cancer, which I don't think I can cure cancer, but I do think that I allow the body to help heal itself, and that way your body is more resilient to healing the cancer. But that's another topic for another time.
Okay.
But I've had a lot of flack from a lot of medical doctors. A lot of these pediatricians here when I first got here were like, she's going to snap your baby's neck. Don't go to her. And I'm like, do you want to see a video of what I do? Why don't you come to my office and come see what's going on over here so you can see that I'm not snapping anybody's neck. 7 years later, girl, they're still talking about I'm snapping baby's neck. So I'm like, what patients did I kill? So, I mean, you have to have a little tough skin because you're going to always get some flack from someone.
Yeah, that's true. Yep. I agree. And the documentation and insurance don't help either. So, but it's a part of it. It's part of life.
Oh my gosh, documentation and that's why I'm in cash practice. I can't deal with them people. I can't deal with someone trying to dictate to me what I can and cannot do to someone else.
That's true. And put a time limit.
I know what's best for them because I'm the provider, and you are just some Joe Schmo in a box.
Tell it like it is. I'm telling you. And she means well. I swear she does. Like she just says it. She's like, look, it needs to be said, and I'm gonna be the one to say it.
No offense if you are Joe Schmo and you are working in that box.
Right.
You don't have the amount of intelligence that I have on this patient because you've never seen the person before. And how can you tell me that they only get 12 visits?
True. So true. So, but what about the patients who can't afford it? Like, any suggestions to those who can't afford it? They need it. Do you have like a payment plan? Because that's what I'm going to implement, like a payment plan, sort of, if I can.
Anything you find important in life, you will budget for. I have families who have 7 kids, and that's a lot of money to do at one time. But they find chiropractic to be very beneficial in their life because it's their health care. It's what keeps them healthy.
Gotcha.
And if it's that important, they budget it, girl.
Okay.
Starbucks is really important to some people's lives. You drink Starbucks every morning, even though you have a fixed income, which always drives me nuts. But you always make money for what's important for you.
That's true. So true. True business owner. All right. So did COVID affect your business at all?
Nah, man. We took off 2 weeks to kind of like figure out what we were going to do. We had to manipulate the office to make sure there was enough space in there and everything. We ended up doing outside adjustments, which was grand. You got to experience some of that. Went out, got a portable table out there and just started doing adjustments in the back parking lot on really, really pretty days. So the patients kept coming and we kept adjusting. And honestly, people needed touch so much during that time. We're not allowed to hug anyone. We're not allowed to, be 6 feet from someone.
True.
People need touch. That's a basic need. And people were coming to see me just to get that touch.
Gotcha. Wow. Never even thought about it in that way, but that's awesome. Yeah. So if you guys have any comments or any questions for Dr. Diamond, again, she's a chiropractor, been in business since 2014. If you have, and I'm wondering, like, okay, people are messaging me, like, you have one here. Come on. Ask your question. All right. So is there any advice that you would give to anyone that's interested in becoming a chiropractor?
I hope you're good with sleepless nights. So if you're a mom, you're already prepped. It's hard going to chiropractic school. It's easy to get in. It's hard. It's hard to stay in. Okay. They really try to weed everybody out in the first 3 trimesters. But the reward, it's amazing. Okay. I mean, I would never trade anything for what I do.
Gotcha. So how long is chiropractic schooling? How many years? 3
years straight, sitting in a room, looking outside, wondering what everybody else is doing while you're up studying.
3 years straight. So just like PT, because we go summer, spring, summer, fall, and yeah. You get the breaks. I mean, we still get spring breaks and stuff like that, but
but you don't get a summer break. It's not something you're used to,
Yeah. What about because in PT school we do what we call clinicals. Do you guys do those as well? Yeah. How many clinicals?
A year clinical?
A year. Okay. Okay. Gotcha.
Clinical rotation as well as your schooling at the same time.
Okay. Okay. Are your clinical rotations paid?
No.
Okay.
You get paid
I
one?
found one that was. I was lucky. I found one. It was small amount, but hey, when you're a student, you take anything.
What?
So yes, yes. I found one. Just one.
I shouldn't.
So they do exist. I'm just saying they do exist, but they're hard to find. But it's about the experience anyway. That's why you're there, to be taught. And I mean, you're still a student technically. So.
Sure.
You're like, sure.
It would have been nice to be able to pay for my apartment without that student loan.
True. That's true. That's true. But it's worth it because, like you said, we looking at our patients get better. It's just it makes us feel like, oh yeah, this is worth it. Because we meet them at their lowest. We meet them when they just feel horrible, and then for me to see them walk or to see them not have that pain again, it's all worth it.
I've created a family with my patients because they don't just see me when they're in pain, like I was saying,
Okay.
They see me for their healthcare to maintain their health. And it's a family. We love each other. I watch their babies grow up. I watch their families grow. I have one little girl that I've been seeing since I've been open. She was 4 months old when I first started seeing her. She's 7.
Wow.
It blows my mind when she comes in to get adjusted and hops on that table, and she just loves me and I love her.
Yeah.
That's my family. My business is my family.
Gotcha.
It's awesome.
Gotcha. Yeah, it is. And she has a cute little boy, by the way. He is so and we have that in common too, because both of our kids have food allergies out the wazoo. It's crazy. So managing all of that, and like I said, kudos to you. You are my inspiration because I do understand as far as the kid, and again the things that you deal with yourself. Even that, it's amazing. You're an inspiration, and she's very encouraging for those who want to go into business. She's gonna tell you like it is. So if you want to hear it straight, talk to Dr. Diamond. I'm not gonna let you whine about it. Like I know when I talk to Dr. Diamond that take the whining out of my voice, just talk, because she's gonna be like, okay, well, what you gonna do about it? Like,
I believe if you're gonna complain about something, you better have a solution.
Yeah, there it is.
That's fine. True. You can complain. Go ahead, get it out.
Yeah, get it out.
We'll figure out how to fix it. Otherwise, I don't hear it.
Right. And again, she means well. I swear.
I do. I'm very supportive. I swear.
She is. All right. So I don't have any more questions. Is there anything that I did not ask that you want to share with the youth about life or becoming a chiropractor or being in business? Either one.
Being in business. So many things to say. Don't do it.
No, we're encouraging.
You got to treat your business like it's your baby. It has got to be your baby. Otherwise, it's not going to grow. You have to put some priority into it. And sometimes it's hard to balance life with, your own family and then your business. But you've got to treat it like another child.
Yeah. Yep. That is true. So true. But I think, time management too. I'm learning that like there are certain things around the house it's just not going to get done. It's like, okay, it'll be there.
There is no such thing as time management when you're a mom. All there's such thing is delegation. Girl, if you don't delegate all that stuff out and you don't worry about it, and if it don't get done, that's on them. Be like me, go into your room, start painting so you don't have to see the mess in the front.
Gotcha. Yes. It's full time. I swear. And then I bring business home. Like I do all my documentation here, and it's like, why do I do that? I should just stay over there, have some quiet, and do it. But I don't know. I just
because if you keep your documentation at work, when you get home, you get to be present with your family.
Exactly.
And there's no point in being with your family if you're not going to be present with them.
That's true. Yeah. So true. No, again, tell it like it is. If you ever like do anything, that should be your name. Tell it like it is. Like. All right, you guys. So again, we got Dr. Diamond on. She's an amazing chiropractor here in Shreveport, Louisiana. And again, I respect you and Dr. Cruz so much because again, a lot of people look at us as competitors, and you two have just been amazing and helpful to me. And I cannot thank you enough. I got you here, so I can't thank you. And I'll tell Dr. Cruz that too. So, but I can't thank you enough for all of your help and everything. So.
I just want to watch you grow and thrive in your business. Like, you're going to do so many amazing things for so many people. So
thank you.
It's so awesome to watch you do this.
Thank you. I appreciate it. I know you mean it, because every time I've called, I had a question, you responded, you were on it. So I appreciate you for that, because I was terrified. I'm not gonna lie. Like, going into business this is all new to me, but it's a sharp learning curve, but that's okay. It'll be worth it. I feel
you
like.
Just got to jump in, and you did it. And I hope it feels so good to have jumped in.
Yeah. Yep. And like I said, I have a amazing group of professionals around me, and I do appreciate that. So yeah, here we go. Dr. Diamond Chiropractic. You want to give your address? I know your website is on here, but
my address, 1950 East 70. We just moved. 1950 East 70th Street in Shreveport, Louisiana.
Right. And she has a speech therapist in your office?
We no longer have a speech therapist in our office. She's next door now. She needed more space. Okay. But we have a massage therapist and a certified midwife.
A midwife?
Mm-hmm.
Okay. All right. So there you have it. If you are pregnant or have young kids that need adjusting, and stop by. Do you do anything for example, for me, a lot of patients don't know when they need pelvic floor physical therapy. Do you offer anything that they can come in and say, hey, I don't know if my child needs adjusting or if I need adjusting, like a free consult or anything like that? I'm just asking, even though I know the answer.
We do consultations, but if you got a spine, you probably need to get adjusted.
Okay.
But, there are definitely some signs, like with children who are older, bedwetting, babies, colic, reflux, things like that. It's just dis-ease in the body. So I just align all that back up and get the nervous system functioning correctly, and usually all those problems go away.
All right. Okay. So I don't see any comments. I've stalled. I was like, come on, you guys ask something, but I think we're done. I asked everything, and
if anybody has any questions, they can go ahead and go to my website and email me from there, and I'll be happy to guide them in the right direction.
And she's very helpful, y'all. Seriously, reach out. So thanks again, Dr. Diamond. And you guys stay warm. Yes. It should be over by Sunday from what I understand. So
it's over by tomorrow.
Yeah, but I don't know. It melts and then it freezes. So then we get ice. So, that's okay. Just stay warm. We got it. Okay. It's supposed to rain Sunday. So, but thanks again. And I'll be in touch.
All right. Bye.
Bye-bye. Thanks, y'all. Good night.